Hey everybody, it's Jonathan Martin. I'm doing the Core Values Questionnaire blog. After doing the Core Values Questionnaire, the two top, core values that I have are that of love and family. And as far as those go, I think that love and family can be a very important factor in determining, the type of care and things that you're going to give, especially like if you're a patient advocate for a patient that is having some issues and their family's involved and everything like that, or if you see a little bit of something that happened to you in the past with that patient, and maybe you can kind of identify with it. In the case of Jahai and her family, they definitely needed some patient advocacy somewhere. There, in my opinion, there was something just not right about that whole situation with the doctors. I understand that they were trying to tell her that she was brain dead and things like that, but the family stating that she had somebody or a physician that was involved that said that she wasn't dead. So without being there, who's to know? I do know though that maybe if there was more of a diverse population within that hospital, that they may have had another, advocate or something like that there, or somebody that they could talk to, or somebody that they could identify with. In the article that I read, which is called The Diversity Imperative Strategies to Address a Diverse Nursing Workforce, the author, Joanne Noon, actually says that minority nurses are underrepresented in today's nursing workforce as compared with U.S. ethnicity demographics, which means that we just don't have enough diverse nursing workforce throughout the United States. And perhaps if we did, they may have had a person or physician or somebody that they could talk to. Two of the code of ethics provisions or ANA provisions that I think could definitely be challenged in this whole situation with Jahai or her family are: one, the relationship with the patients and the families, which is ANA provision 1.2. In that case, what type of relationship was being built with the family and with the patient. Of course, with her being considered brain dead and things like that, was a relationship being built with the family? Because it really doesn't seem to be that they built anything. We got the impression from the family that they just wanted to kind of end her life and be done and kind of wash their hands of it. The other one that I said that we could probably challenge would be provision 3.6, or patient protection. And was the patient really being protected? I don't know. We're getting stories from the family that she's responding to verbal stimuli. She's, responding to touch and, things like that. And then they've got an apparent doctor who is saying that the patient is not dead. So, what is the story behind that? Are we doing everything that we can and, taking all the clues that we're given to make sure that this patient is actually being treated appropriately and the family and the patient are being protected? Two of the AONE, competencies that can be challenged, I would say, would be the effective communication. Were they effectively communicating with that family, or were they just giving them, she's brain dead and that's it, and no reasons for it and things like that? I would guess the prior that they weren't getting a lot of information, which is a big problem in a hospital when patients are trying to find out, or patients and family are trying to find out information, and nobody's really talking to them, or they've got three people giving them different information. What were they being told? Another one that I think would be the relationship or with building trust and, collaborative relationship between the staff, other disciplines, things like that. What are we utilizing all of our, essentially everything that we could to help this patient out, help the family out, and things like that? Did the family feel that they were being helped? I don't think so, because they had a lot of complaints on that video. So, in all of that being said, I think that she would have, if they had a diverse workforce and things like that, and they had more patients, more nurses, healthcare practitioners, physicians, somebody maybe that they could identify with, and somebody that they felt confident in, speaking with, they may have reacted a little bit different. Who knows? Maybe if they had somebody explain things a little bit better, they would have been better off. Thank you for your time. Again, this is Jonathan Martin, and the article that I read was The Diversity Impairment Strategies to Address a Diverse Nursing Workforce by Joanne Noon. She is a family nurse practitioner, and I received this from the website, and I will post this on the blog itself. Thank you all, and have a good evening.